Hi, and welcome to the Healthcare CEO Show, where you'll find actionable insights on healthcare leadership from the best and brightest in the industry. I'm your host, Daniel Fernandez. Let's get a pulse. Joining me today, I have David Guth. David is the CEO of Centerstone. Centerstone provides mental health and addiction recovery services throughout Indiana, Tennessee, Illinois, Georgia, and Florida, with an extended network throughout the US. Today, we're going to be talking about the important topic of mental health and hey, what about the caregivers who care for these patients? But before we get started, let me welcome David to the show. Welcome, David.
Daniel, it's a pleasure to be with you today. Thank you.
Now, mental health has been a hot topic and it's being discussed, I feel like now probably more than ever. And it's no secret that the past year has been challenging on multiple fronts. For many, it's been overwhelming and has affected their mental health. In June of 2020, the CDC reported that 40% of US adults were struggling with mental health or substance use. So my question to you, David, is, are we doing enough as a nation to combat mental health and substance use care, or is systemic change needed?
Yeah, so systemic change is needed. We've come a long way in the years that I've been working in this field. We've come a long way, but we still have a long ways to go. And specifically, when you think of the impact of the pandemic, you have to remember there were two epidemics going on before COVID. There was the epidemic in this country of suicide, and there was the epidemic of deaths that were related to opiate addiction. And so these were going strong, unfortunately, before COVID hit. The other is that the stressors of COVID in particular have an impact on not only exacerbating the conditions of mental illness and trauma and addiction, but they also can be triggering events for these conditions as well. So, it clearly the pandemic has greatly exacerbated the need, and we need to do more. I'd say the good news is that we're seeing a lot of interest at the federal level, both in Congress and out of the White House, really both sides of the aisle, both chambers, to do more. We see increased attention to this at the state and local level as well, but there's a lot more that needs to be done.
Now, you briefly touched on suicide rates. I believe in that same CDC study, it mentioned that roughly 11% were having suicidal thoughts.
Yeah.
Have you seen or heard about increases, due to the pandemic, or decreases, or what's that?
Yeah. So we know that suicide is still a leading cause of death among a number of populations. It is across the country, but it's particularly dangerous around with the young, particularly the adolescent population, and with the elderly. I mean, this has been, and again, these trends have been exacerbated by COVID. So it's something that's of significant concern to us. It's just an aside, but at Centerstone, we've got a research-proven protocol that helps identify really the suicide risk of individuals that present. It's a whole combination of factors, including having ideation of suicide as being one of those factors.
Yeah. Mental health, for the most part, has always been one of those sort of taboo topics you're not typically talking about around the dinner table, at least pre-COVID. Have you seen a shift in how mental health is perceived due to the pandemic? I mean, we've all been sort of isolated in these little boxes.
Yeah, the number one barrier for people accessing care around getting the payments for behavioral health care on parity with other health conditions, the number one barrier around all of that has been stigma. And, we're not the only area of healthcare where this has been true over the years. I tell this story many times. In my grandmother's house when I was a kid, if somebody had cancer, the adults would whisper about it. It wasn't something that was talked about. It wasn't understood. Particularly, it wasn't understood by the public. And we think today and think, well, why would anybody feel shame or whisper around cancer? Why would that be a taboo topic to talk about out loud? Well, and it's not. I mean, now People recover from cancer. They go into complete remission and cures, and it's well understood in many areas. And the public's whole attitude about it has changed, and funding for it has been phenomenal. Mental health is behind that. When I started my career, there was a very poor understanding of what caused mental illness and addiction. That's not true today. I mean, the science of this has changed dramatically, changed our understanding of what is the root cause, how do these conditions manifest themselves, and what is effective treatment. So today, most of the conditions we treat, particularly if caught early, have tremendous recovery rates, far exceeding other areas of healthcare. All that to say, long answer, stigma is the problem. It has been slowly eradicating. The difference even pre-COVID to where it was, say, earlier in my career, phenomenally different. I can give you some stories about that if you're interested. But you saw with the pandemic, the public discussion around the stressors, the public discussion around the impact that this has on mental health. So we feel like we've made, unfortunately, through the pandemic, but we've made significant progress as a country this past year in the open dialogue around mental illness and addiction.
Do you think that to some extent it's because so many people were impacted and affected by the mental health?
Oh, yes, I think that's a big part of it. One of our prior Surgeon Generals talked about how the number one health crisis in the country, and this goes a number of years back, was isolation. Not just mental health, but the number one health crisis was isolation and the impact that had on people's health. Well, you think about what this past year has done in terms of isolation. And so, I think, long answer your question, but I think absolutely this year has had a big impact on how people think about it. You've got the group that's been further isolated. You've got those that weren't isolated before that have been. You've got people that were under tremendous financial strain. Think about the people that lost their jobs over this, fear of losing their job. Just people, and in addition to isolation, you had others that were, because of their work, were forced to be out there in what they understood to be a very dangerous situation themselves and their families. And just think of the stressors that caused when people were out there having to work before even PPE was available, and many of them with vulnerable family members at home. And then you had loss. Let's not forget that nearly 600,000 Americans have lost their lives to this pandemic. And think about the millions of people that love those 600,000 people, that when the pandemic is over, the impact of that's not over. And that doesn't begin to count the millions of people that have long-term health impact as a result of this. The young people have had double lung transplants that will struggle with that the rest of their lives. The people that have developed this chronic fatigue that is oftentimes in the aftermath of that. So, for many of Americans, when the pandemic is over, the pandemic's over. But for tens of millions of Americans, the lasting impact of this will go on for a long time. So, long answer, but yes.
Yeah. And speaking of, there's probably an increase in demand, or have you seen an increase in demand for mental health services?
Absolutely. We have been throughout the pandemic adding resources to our front door, if you will, our virtual front door, our call center. I'll tell you, we can't add staff fast enough to deal with both the call volume and then the clinical services that are needed once somebody has reached us. So, anybody's listening that's attempted to get in touch with Centerstone, we've got, tens of thousands of new patients that come through the door. But we also know that it sometimes takes them way too long to get the phone answered, and oftentimes way too long to get an appointment scheduled. and it's just because the volume has just gone up. There's a shortage of clinical staff in
Okay.
all forms across behavioral health, and that's nationwide.
Right. And I would add to that, it's not even just behavioral health, it's across all healthcare, it seems like, in our discussions that we're having. And you have 3,900 employees, and you're caring for over 140,000 patients. Recruitment seems to be a focal point for a lot of organizations today, because, of course, there seems to be this shortage of caregivers. Do you agree?
Absolutely. And so I think the pandemic has brought that into clear focus because on the one hand, we are with telehealth, and we'll talk a little bit about that, but with telehealth, it's enabled us to connect clinicians to people that don't have to be physically proximate. So that's opened up a lot of opportunity. But it's also demonstrated that what might have been perceived as regional access issues or regional shortages has now put a clear light. This is a national shortage. It just is.
Now let's talk about telehealth, for example. It's something that was quickly rolled out by a lot of organizations, even though that was sort of seen as let's just say it wasn't really favored by many organizations prior to the pandemic. But then it became a way of practicing. Are you seeing that this will continue, or are you seeing, the future having some sort of like blended approach where you have in-person combined with those like telehealth services?
Yeah, so it's a really great question. We sent 3,500 of our staff to a work at home environment the week of March 16th, a little over a year ago. That week, and I have to just say kudos to our technology team, because it wasn't just the heroics they did that week, but it was all the infrastructure that we had built leading up to this. So whether it was therapists, psychiatrists, counselors, but also, human resources, revenue cycle, all that. We sent all those folks to work at home environment. And since that week, we've delivered 1.6 million services via telehealth, 1.6 million. And some organizations were more prepared to do this than others. But over time, this whole year has caused both the provider community and the public to realize the benefits of telehealth. Now, it's not for everybody. I'll give you a couple examples in the behavioral health space. We serve a whole range of individuals, and for those that might be coming to us because of perhaps domestic violence, oftentimes people reach out to us for help before they are able to separate from the abuser. And can you imagine how telehealth works in that situation if you're in a home and that abuser might still be there? And so there are people for whom that doesn't work. There are people for whom the technology is not available. They live in we serve a lot of rural communities in addition to the other communities we serve. And there's still a lot of gaps in coverage. So, and then there's also resource gaps. To have good internet access requires resources. And it is now, and it's going to be an important highway to healthcare in the future. And so, making sure that not only is good quality internet available, but that it's affordable to populations is going to be a big important thing. But it doesn't work for everybody. And as we are beginning to do, and throughout the year, we've been, as patient safety can be guaranteed, as we can make sure that we're covering staff safety, and based on patient need, we have been moving back to hybrid services. And we expect to be into the new normal for our services on or about the 1st of July, which means that we will be providing care based on where the person's clinical needs are, with the ability to really keep people safe relative to COVID. I expect that a lot of our staff will work a significant portion of their time at home. Others will work full-time at home, and we'll have some staff that are working full-time in the office. A great deal of our patients will be getting their care completely virtually, but there are others that will have a hybrid. So there's not a one-size-fits-all but what telehealth does is it opens up the opportunity for folks to get the type of care delivery that works for them. You mentioned, I'll say one more thing on this if I may. We talked about stigma just a moment ago. Think about getting care in our rural communities. I've heard this over the years that one of the barriers is folks not wanting to park their car in front of a mental health clinic because their neighbors and so forth see that. There's also the concern about seeing a therapist that they're going to run into in the grocery store, or maybe is somebody they went to school with, or, all the connections you have in a rural community. So telehealth can do a lot around those stigma issues. Being able to do this from the privacy of your home, being able to be connected to a therapist that's not in your community. And, with Centerstone, oftentimes people want somebody that really understands a community of their size. Unless I want somebody from Manhattan providing therapy to them if they're from a small town. But, we can connect them with therapists that live and work and are raised in small towns, but not their small town. So it's broken down a lot of barriers.
Yeah, that's a very excellent point. In terms of caregivers, let's kind of shift back towards recruitment, because recruitment is such a hot topic. Are traditional methods of recruitment dead? I mean, the days of just kind of posting a job description and just hoping somebody will apply, or is it time for, sort of new, innovative and creative solutions?
Yeah, I think it's a huge change. Some of this was changing already, but particularly when you think of therapists and counselors and others thinking that they could pretty much live anywhere and their work could be anywhere. It is really more of a national job market, if you will. And so, we're doing different things at Centerstone. We are looking to get in front of people early in their, before they're even ready to look for a job, to get in front of them. We've got a partnership that we're launching with a company called Triad Behavioral Health. They do the majority of the test prep for clinicians in the behavioral healthcare field. And so they've got access to people that are preparing to stand for licensure exams. And so our ability to get in front of those people with job opportunities and also guidance about what kinds of specialties are we seeing so much demand that we really are having a difficult time finding people. So that's just one example. There's scores of others, but it's going to be very, very different.
Got it. And because of the last year particularly, we know it's been very stressful for all caregivers. In those that are potentially looking to make shifts, are you seeing any sort of commonalities or patterns? Like maybe they're looking for maybe more flexibility or a good culture or things of that nature?
Well, I think there's some of the same things that happened before, that were drivers before COVID, is, people want to work for a company that's got a good reputation and has a reputation for the kinds of ethics that those individuals have, right? So you want to look for a company that's reputable. You are concerned about compensation and benefits, and what we hear is that people are interested in a company that's going to invest in continuing to build their skills and their future. So, training is particularly in the clinical areas. Clinicians get into this because they want to make a difference in people's lives. And so the ability to get really great training is something that Centerstone's very committed to. And I could say more about what we're doing in the area of simulation training for therapists. But what we've seen in COVID is, I think there's a new awareness of the organizations that are committed to the safety and health. And the other is social justice. I'll say a little bit about that too, but these are all issues that have always been important, but I think are more front and center, both in the minds of the people seeking work, the people that are working inside of a company, and certainly for Centerstone, they're top of mind for our organization.
Yeah.
I'm happy to talk more about any of those issues.
Yeah. And, you know, and on the same topic, you can't really have a discussion about recruitment without talking about retention. If you have amazing people, you want to keep them, right?
Absolutely.
So how important is employee satisfaction, team member satisfaction as part of that?
You know, it certainly is important because, like you say, there's you know, the best way to keep your positions full isn't to go out there doing a lot of hiring. The best is to have a satisfied workforce. You know, we know that with telehealth, we've already seen this where, and just because of the size of Centerstone, we have employees that maybe a spouse gets relocated or something, and they're able to stay inside the Centerstone system and move. With telehealth, we've seen that. We've had people that have moved during the pandemic and been able to continue their jobs. But we also know that people leave organizations like ours for lots of other reasons. And so, you know, what we don't want them to do is we don't want them to leave because they don't feel supported or don't feel like they have opportunities. So that's very important to us. I'll say this: we use McLean for our staff satisfaction, and prior to COVID, Daniel, our staff satisfaction scores were right at the average score of all the McLean companies. And during COVID, our satisfaction scores doubled. And I think that was because employees got to see our focus on their safety, and I think that meant something to them. You know, we're not taking that for granted. We know that the COVID effect is going to be in the rearview mirror, and so, you know, we're really looking at how do we help really make sure that that our staff that are spread out across this big footprint really are engaged. Again, I can say more about some of those activities, but it's very important. And we have to have strategies that do that, not just intent.
Yeah. In a world where companies and specifically leadership roles seem to be evolving at the speed of light, like you have new titles popping up pretty much, it feels like every day. There are rumors about a new type of C-suite team member called the Chief Satisfaction Officer. It's one of the newest ones. They're supposed to be responsible for the maintenance and growth of the company culture and happiness. It's said to be like a blended role between the CEO, HR, and marketing, really.
Well, I think that role belongs to all of us, honestly, Daniel.
Okay.
I think that if you're in leadership in an organization, particularly, you know, a healthcare organization, then, you know, the satisfaction of your staff is a reflection on how well services are being delivered to the people that are coming to you for care. And so I think that all of us own that. You know, I will say that we're very blessed with our Chief Human Resource Officer, who I would tell you, if you were to ask him, Jason Hernandez, who is the Chief Satisfaction Officer at Centerstone, he would raise his hand and say, "That's me. That's the number one part of my job." I think the rest of our team would go, and you know, it is certainly number one priority for all of us too. My philosophy is that if you're taking care of the people that provide care, then the people that get care get extraordinary care. It's all about the clinical teams. And are they getting the training they need, the support they need? Are you addressing turnover issues? Are you creating a stable and healthy workforce? And most of the concerns over the years that we've heard from staff that maybe do leave us is that there's been something that's made their job difficult to do. And that's not on them, that's on us. Yeah. Anyway, long answer.
And because we have, you know, a follower base of, you know, CEOs and healthcare leaders, I have to ask the obvious question. How does David take care of David?
Yeah. Well, you know, that's another good question. During the early stages of the pandemic, I didn't. You know, I was at one point about 35 pounds heavier than I am now. And a lot of that was put on in the first few months of the pandemic. I would spend 12 to 14 hours a day in this chair and back to back, apologizing to people if I had to make a quick run down the hall. And I know, with the audience on this podcast, they're all going, yep, same thing. So exercise, what was that? Spending time with the family, what was that? And just all the other issues. So, and it wasn't just me, it was across our system. I got called out for that by my team. My chief of staff said, David, if you're not taking time off, the rest of the team's not taking time off. So you got to be deliberate. Start taking some Fridays. The world will still be here. Start taking some time off, taking care of yourself, because the rest of the team's not going to do it unless you do. So I did that. I lost about 35 pounds. Started doing some exercising and spent a little more time with my family. So I'm doing more to take care of myself, not just for me and not just for my family, but really knowing that there are eyes on that, right? So I suspect that my story is the same as pretty much everybody that's listening to this podcast.
It very much is. And I think that everybody has a story that they can relate to. And that is just such a powerful message, because you feel like you're not alone, especially if you're listening to this podcast as well, because you're hearing from other leaders such as yourself, and those same sentiments are being echoed. Before I let you go, David, I've got a couple of closing questions I ask every guest.
Sure.
The first of which is, do you have a favorite book or book you've read recently that you recommend?
Well, I'm gonna jump out there and talk about a couple of them real quick. One is if you haven't read Dreamland, and I always have Sam Quion's. I think I'm messing up his last name, but Sam wrote a brilliant book. This is really details all aspects of the opioid crisis. There's another book coming out actually that I've got on my Amazon list as soon as it comes out, and it's called Canary in the Coal Mine. It also really speaks to both the opiate epidemic and the AIDS epidemic in a small rural county, Scott County, Indiana. I happen to have had an opportunity to meet and talk with the physician that wrote it, and understand the efforts that he and others in the community meant to transform that. And it's a story that really talks about the transformational nature that we can have inside of our communities in the treatment of addiction, and really the results, the impact that has on the broader community. So it's great. It's a great story. I'm really looking forward to reading the whole book. I've seen excerpts of it. The other one is just, if you haven't read Utopia for Realists, particularly in this time, I highly recommend that book, written by a young economist. And I think it's instructive for all of us. And I think there's some, it also puts some of what we're going through in some perspective, that we need to step back and recognize that as a human population, progress has been made, even though we at times see the short-term losses. So anyway, I won't go more into that, but those are all great reads. Got lots more, but I know we're running out of time.
And, as you mentioned earlier, the last year has been challenging for everybody on planet Earth. What has the last year taught you, David, personally?
Yeah, well, first of all, it's taught me just how privileged and blessed I am to be in a field that really does create healing for people. It's what drew me to this field, but that's one. I have to just say a renewed sense of humility. When this pandemic started, I started calling our staff randomly, just to see how they were doing. Of course, I couldn't get to all 3,900, but I talked to hundreds of them, and I continue to do that today. I always will, for the rest of my career now, make those random calls. And what I saw was just amazing, people doing amazing things. These folks were all thrown into these home environments with, it took us many weeks to get, office chairs to them and things like that. So people that were sitting on kitchen chairs for 12 hours a day, providing care. I talked to a therapist that was operating out of her basement, one that was operating out of her garage because it was the only place they could have a private, HIPAA compliant conversation with their therapist. Just heroics. And so, I talked to one therapist who lived in a 2-bedroom apartment, and her daughter had lost her job, and so daughter and grandkids move in with her, and she's back in one of those 2 rooms doing therapy while the family's all dealing with this. People whose loved ones were still out there providing, emergency medicine without proper PPE in those early stages. Just the heroics of people. And you've seen some of this in the media, but I don't think the media can capture just how many people made extraordinary sacrifices for their families, for their communities, and for their nation. And I think I wore masks whenever I was out, not just for myself and for my family, but for this country. I'm very aware of the sacrifice our men and women in uniform make every day for this country and the risks they put themselves through. To be asked to wear a mask, to be asked to take a vaccine, if not for yourself and if not for your loved one, on behalf of this country. We are waging a war against, an invisible enemy, but an enemy that's claimed 600,000 of our citizens. I'm going to do my part on behalf of this country. And I'm happy to wave that flag. I'm proud of this country, and I am really privileged to be able to do my part to help defeat the virus. Anyway.
I love that.
My soapbox, sorry.
I know, and I love that. And with the closing thoughts, what advice would you give to that CEO or healthcare leader who's listening to this podcast right now?
Yeah, so we oftentimes get overstressed by all, you mentioned this, Daniel, just the changes that our organizations are being asked, the changes that we need to make in order to be the leaders of the organizations going forward. And what I would say to you is that I've been at this long enough that I remember when very little changed in healthcare. There was very few moving pieces. And I would much rather be in a situation where we're overwhelmed by change than locked into a system that really didn't work for many people and many people across this country and the world. This is a time for leadership. This is a time for all of us that are in leadership to learn new skills, to be bold, and to know that we can help shape the healthcare system for tomorrow, and we need to. So it's going to be tough. It's going to be a little bit, we're going to be uncharted territory, but we got our organizations through this last year. We can do this. And so I want to thank them. If they're on this podcast, it means that they got their organizations through this last year. I want to thank them for doing it. That benefits our nation greatly.
Thank you for joining us on the Healthcare CEO Show. If you've enjoyed this episode, don't forget to subscribe on your favorite podcast platform for more insights from the top. Until next time, lead boldly and care deeply. See you on the next episode.